Today I'm going to talk about the unmet promises to girls, what they are, how we can map them at the community level, and how they fit into our theory of change and programming approach. In an earlier lecture, I laid out the broadest framework possible for the investments in girls, and these actually frame the social contract, the one we are trying to explore at the community level. The 6 MDGs: reversing intergenerational poverty, universal primary education, and with girls a special emphasis on actually beyond secondary education, keeping them in school during adolescence, establishing gender equality norms and practice and safety for girls early on, reducing maternal mortality, acknowledging that the youngest first-time mothers carry a very significant risk and one that proportionally will rise as fertility falls, staunching the increasingly young and persistently female HIV epidemic in HIV-affected countries. The unfinished business at hand is often not only the young populations, but the extremely high ratios female to male of infection among 15 to 24-year-olds, and rebalancing the resource population equation, the exploration of how investments in girls in high fertility poor countries, which allow them to delay both sexual relations and childbearing by 5 years, have radically positive effects on their lives and also drive potentially radical change at the subnational community, and I would allege also national levels, such that they can delay childbearing, there's a longer space between generations, the overall numbers of children and size of populations is contained, while at the same time the investments in the girls create new productive resources which are distributed more equitably. Now those MDGs, however expressed, and I've just given you a very quick rundown, most countries have a series of goals. They want to reduce maternal mortality. They want to assure that 100% of kids, male and female, begin school on time and finish 8 or 10 years. They define childhood in line with the Convention on the Rights of the Child, which is marriage under 18 is illegal and unconsented. These are the compacts that most of the populations that we are dealing with live under. Mainly the policies are pretty good. The problem is that they have not been resourced. And we need to look very specifically within the communities in which we work at how these promises are mobilized at the community level. On the screen, you'll see some icons that represent secondary school, youth center, community center, roads in a market, development committee, health center, playing field, national savings. These are kind of the physical representations of what is a very abstract, unseen social contract. Then these facilities create the opportunity structure, the learning structure, the socialization structure of our girls. Now in those communities, the boys have, not perfect, but they have often very high access, and not only to these institutions, but when they want, their timings. If you look at the day of a boy of 15, my colleague Kelly Holman has done a wonderful, very rigorous study of this. A boy of 15 can move around a great proportion of his community, and it gets larger as he gets older. But for a girl, that community is quite small, and there are a few pathways she can use. So the boys have superior access. They can go to places without risk. The better off girls have some access, not perfect, but they may be getting themselves to school, get health checkups when they need them. But our girls, the bottom 40%, are excluded. So when people say, what's the scale plan? What does success look like? Well, in the first instance, it looks like these girls getting access to their rights, not being excluded. In a way, we're helping the girls not only join their communities, but we're exercising the Constitution. This is a really important concept. Much of what we are doing, I think, is not just bedrock importance to health, to fertility reduction, to economic empowerment, but it is basically practicing the Constitution, practicing justice, establishing a base of participation. It's the sustainable base that will keep communities that become marginalized alive. I'm taking a moment here to focus on timing because there's a high cost to denying girls their rights. In early adolescence, many girls irrevocably lose their rights. There are rights that are delayed. Now, it happens later than it should. You're allowed in many countries to have a bank account at 10. If you don't get it till 15, well, that's not great, but it's still there. There are rights that are costly to recover, and such as you've left school and getting back on track in school, and then in truth, very few second chance programs. So in theory, if you've left school, you can go back to school, you can continue skill training. And there are rights that are irremediably lost, and our girls look at losing rights irretrievably. Concepts of self, human potential, and new facts in their lives. Often between the ages of 10 and 14, these worst things happen. They lose part of their body to FGM, literally a piece of their bodily integrity is harmed. They experience forced sex, which apart from the brutality of it and the other consequences, disease, pregnancy, is the experience of not owning your body, so that girls who've had that experience may never actually recover the full capacity to think of themselves as independent agents. You become infected with HIV. Yes, there are treatments, but there's no cure. These are very expensive. They're hard to practice. And the way those entitlements are structured, often we have populations who take their HIV medication only up to a certain level because they're afraid of losing other entitlements, money for their children. Having HIV is a real struggle and a lifetime challenge. Or having a child when you're still a child, not even getting the investment in your own children before you have the responsibility, which many very young girls take very seriously, of having another child. And by virtue of their age, in the context of the constitutions we've just discussed, you're having a child under 18 in most places. You're doubly violated. You have been married or forced into sexual union, and now you have a second step. You have the responsibility of a child. So we focus our work on the most extreme outcomes. We sort of taking the human rights framework and saying, yes, all people have rights and needs, but some populations face, first of all, much higher levels of human rights abuses from which there is no return. And we must look at the resources for youth and adolescents within this framework because the resources are limited. And in most of our work, we propose driving resources to those who are at the highest risk of the worst violations of their human rights at the youngest ages. That will usually take you directly to adolescent girls. Another way of seeing this is to consider the role of structural and individual violence. It's a systematic way of denying girls meaningful access to their promised resources. Obviously, there are many consequences at the bodily level, intergenerationally, families in which girls have experienced violence. This is replicated into the future. Measurable mental health risk, lots of bad things at the individual level. But it's still quite pathologized as exceptional, and the stigma attaches to the girl. Let's look at it as a structural issue. Let's look at it literally as almost a plan of disinvestment. On the one hand, we're going to make these promises, the secondary school, the youth center, the playing field, the national savings. But what can we do to make sure that these girls don't actually use those resources? Well, violence and acting with impunity against these populations is like as if there's a ministry of disinvestment, blocking those girls from access to things that they have unalienable rights to, and that in many cases have even been funded based on these girls' needs. How many places have created the health center because they're concerned about maternal mortality? How many places have developed a youth center as a safety net? Yet the girls with the greatest need for these are systematically excluded, and violence and social norms stand between them in many cases and that access. So there's no way we can talk about repairing the social contract without talking about building protective assets and guaranteeing girls safe access with much more flexible timings than they have now to the facilities, entitlements, and services in their communities. So we have an exercise, and you can think about it actually wherever you are, but let's pick a community, and let's think about it. You're a 12-year-old girl. What are the places you can walk to? What do you call your neighborhood? What do you call your catchment area? On your representative community map, we want you to identify up to 15 important services, locations, resources, facilities in the community in which you are working that are potentially important resources for girls, whether or not they have access now. My eldest daughter was particularly interested in social change from a very early age, and she would sometimes talk about "Oh, Mommy, there are so many," quote, "resources," unquote. And she had the kind of imagination in which she could look and see that a school wasn't just a school, it was a place you could meet. She'd see a church the same way. She'd see the, person who ran the card store as another resource. She was very much alive to it, and she felt free and she felt safe. So sometimes we don't see these things because we've never been there and they don't seem like they're for us. And you'll get those reports from girls and their mothers. "Gosh, this is the first time we've ever gone into the community center. We've never been in the Cabelli house. I always stayed away from that playing field because I was afraid what would happen." It isn't alive to them that these are places that were meant for them. Now take out your map, maybe make a circle, and just start drawing. What features are in this community? A railway track, a swamp, a bus station, ethnic or linguistic divisions, migration areas, a market, and any important seasonality. Start thinking about this community as a dynamic social entity. Now you put on that map health services, hours and the hours that services are offered, emergency services, shelters, schools, non-governmental organization programs, feeding programs, youth programs, and query who is served. Are there dedicated hours for girls? Commercial and market centers, training centers, financial institutions, credit sources, wine stores, beauty parlors, a whole range of places which one group of people can go to and use regularly and others can't. In the civil rights movement in the United States, it was absolutely essential that the black churches functioned. It was a place where people could learn about voting rights, they could be organized. What we're dealing with our girls is, in effect, trying to make those communities begin to function with the minimum social access. But they don't have their own, so to speak, churches. They don't have their own places. But let's see what's already there that we might get them into initially. This is a map that one of our partners in South Asia put together, and it was a very modest community. The community had 365 people in it, of which 55 were girls, more or less between the ages of 6 and 18. For every 3 girls, there was one community resource. It's sort of a peculiar way of talking about it, but it begins to give a sense of how much density there is, even in very poor communities. This represents what's on the ground already in a very poor community, may represent a couple $100,000 of investment, and also a structure through which opportunities and investments and expansion of the economy and social life can proceed. So there's a huge investment on the ground from which girls are excluded. In the case of this place, which had high levels of trafficking, high school, bank, Panchayat Raj was the village council. There was actually a college, vocational training, post office, a playground, a mosque, a temple. ICDS was a government program, markets and a road, there was a hospital, a court, a police office, a middle school, a technical institute, a community center, in a community of 365 people. There were all these things. So from the point of view of just physical facilities alone, it was a rich community from which the girls were excluded. So going back to this visual, if you've mapped out where the different facilities are, you will have also begun to think about different categories of girls, because when we go to disadvantaged girls, there's not just one kind. So in this case, I'm positing 3 segments. The girls 10 to 14 living apart, who are socially isolated, not living with their parents, and they're not in school. I'm positing the girls of school age that are in school but a little off track, and come from families that maybe live in a specific part of town and are linguistically separate. And then the third group in this case are the girls that have been married, that are currently between the ages of 15 and 22. And I'm going to think about what I can do to specifically guide them into the existing community resources. So I begin to create the hands coming up, the hands coming down, our specific plans to link just what's there to our girl groups. Now, the girl groups are in platforms. That is, we are literally collecting the girls into these community-based groups along the line so that they have peers, which they haven't had before. So girls are with girls like themselves, because in general, if the groups are very mixed, married girls don't mix with unmarried girls, schooled girls not with unschooled girls, and ages are important. But when they get in a real peer group, group. There's a desire to be with each other and a solidarity, which allows them to communicate. That by itself is an asset in itself. But from those platforms, you then can create plans to access these other resources. And this is the piece that is more like collective bargaining. I've got different classes of excluded populations. Now we're going to get them access to different parts of this community. So when the full vision comes in, you have, and I have little boxes here I'll explain, thought and said, all right, so I've got some priorities here. And we can't do everything in the first year, but I now know what the girls need. They're strengthened. They have a place for their voice. They're meeting regularly. They have some preliminary safety nets. What would I ask of this community? Here are a few things. The playing field. They haven't been there. We want to have scheduled girl times with female mentors. This can't cost much money. In fact, you could even do it with volunteer structures, but what you'd need is the village to say, we get it. This was a place, girls need to move and be free. They don't want to do it when the boys are there. They want some privacy, and we're going to reserve a time when they can go there safely. I remember once being in Tanzania and seeing the boys who very creatively made balls out of pressed paper, and they were kicking the ball back and forth, having a great time. And their sisters were basically walking back and forth with water on their head. And my little girls, who had been used to access, literally charged into the field, and everyone was shocked to see that there were girls in this field. Now, of course, we know there's tremendous athletic ability in girls as well as boys, and the pleasure of using their bodies, but they can't. There's no place for them to play. Before we began our work in Egypt, at baseline, only 5%, 6% of the girls nationally had done some physical activity, some game, something the week before, whereas more than half the boys had. And so we especially included in the Upper Egyptian context a place for girls to get comfortable and sort of feel that this was their body and this was their place. And so they did sports and warm-ups and other things. A couple times a week when the program was about 4 or 5 months old, when the community's gotten used to, in this very conservative community, the girls being regularly going out in public space and going to this program, which was in the youth center, and then very specially being able to play. And in a few places, they still have access to the playing field. But that was important from the point of view of a community contract. We have to make the change permanent. So let's get a permanent agreement about the community contract, about the community playing field. Looking at youth centers, these are places which have often been built with loans from the bank, very big investments. They're completely dominated by older male populations, often places which are dangerous and stigmatizing for girls to go. Imagine creating age and gender specific slots so that the 10 to 14-year-old girls with a female mentor have that place, but now it's going to be permanentized. This would make much better use of the youth centers and so forth than we currently have. They're very underutilized overall, and they're specifically not utilized by some of the populations in greatest need, the youngest girls, the married girls, for example. The health center. Okay, the health center may be a place where a somewhat better off girl or a girl who's pregnant and married goes, but the 12-year-old girl can be checked in. A 12-year-old girl could have, and this has been done in Ethiopia, with her ID, all the girls in the group, these are girls mainly sort of 8 to 15 who are living apart from parents, many in domestic service, are registered as a group at the health center, and then they're given a health voucher, and then they go when they feel they have a health need, without the shadow of stigma of HIV or rape, or just because they have the right to. So if these things are thought through, we can begin to have this full vision, a community that is accessible to different categories of disadvantaged girls with specific plans, and thereby bring the hand of society and inclusion down and bring the hand of participation and strength up to join and meet.